So I want to provide another illustrative example, like based on this title of like this was published, I think about this in a really curious framing about how racial disparities or inequities to care are described and even framed. This title basically reads, Black Canadians more likely to be hesitant about COVID-19 vaccines, surveys suggest. There's a lot going on with this title and it provides really interesting assumptions. Like, for example, this is an example of Racecraft, which is a concept developed by Fields. I think their name is, one is Karen Fields and Barbara Fields, who talk about Racecraft. So this is an example of Racecraft. Here we see racism, access to resources, or in this case, the COVID vaccine, conceal itself and then reappear as race, the attitudes that individual Black people have about the vaccine. So basically, if the problem is the attitudes that individual Black people have about vaccines, then the solution becomes something like public awareness campaigns. So, and it really basically hides the idea of how medical racism or just racism plays a role in shaping access to vaccines or care, in generally speaking. So the concept of racecraft becomes a really important tool when we start dissecting issues or studies that come about simply about like, okay, well, XYZ group doesn't receive care because they have hesitations or certain ideas. It's like, okay, but like, that's not the full case. We have to understand how racism obviously is playing a role, but why are you covering it up, right?